Namaskar, Pranam. Welcome back to another MedEx video on the Freedom from Diabetes channel. I'm Dr. Mayurika Das Biswas, and I'm just very happy today because one of the problems that disturbs almost every other person is disturbed by this issue. What is the issue? Mujhe neend na aaye. Yes, the sleep problem. The sleep problem that doesn't allow you to get that energy that you need throughout the day, the sleep problem that keeps you awake through the night and then worrying and then intensifies your anxiety and multiplies your frustration. We're going to be addressing that problem, and we have a really learned, renowned, regarded expert. He is a cognitive hypnotic coach. He's a trainer. He's also an author. मतलब और क्या बाकी था? Like, he's got so many talents. He has a very, very eclectic approach in counseling, using many techniques and bringing them together and developing a beautiful flow of counseling techniques. He teaches people how to do counseling. He's so well regarded in clinical psychology, treats his illnesses with hypnosis, mindfulness, NLP, metaphor therapy, advanced coaching models. So here we have with us Nitin Shah ji. Nitin ji, thank you so much for your valuable time. Thank you so much for connecting with us on MedEx.
Thank you, Mayurika, for inviting me, and thank you for all those nice words about me when you began. But truly, when you speak about sleep, it is an interesting challenge that a lot of people have. I say interesting because it's both, right? It can be a cause for so many problems that people have, and it can be an effect of other problems that they have in their life. And that's actually one of the major problems working with sleep, because you don't know whether you're working with the cause of this problem or are you working with the effect of the problem. But yeah, as we go ahead, probably we'll be able to throw some light on it, and then we'll see how we can work on it.
Sure. So I would really want to know everything about the causes of insomnia, the effects of insomnia, and what is one dealing with more. So it tells me that there are different types of insomnia, sounds like. Is that true? Are there different types of insomnia?
There are different types of insomnia, but those types are divided in different categories. For example, there is an acute or a chronic insomnia. An acute insomnia would be where once in a while you are not able to sleep, right? A chronic insomnia would be when this is happening frequently, where maybe for more than 3 days in a week and over a period of a month, you are not able to sleep. So now the acute condition has literally become a chronic condition. And the distinction is important because many a times with acute insomnia, you may be able to get away with that, in the sense that you can still remain more functional overall as a part of your life. But with chronic insomnia, it becomes more and more difficult because consistently you are not able to sleep, right?
Correct.
So that's one category of ways in which you can divide types of insomnia. Then there's also the what we call as the onset insomnia or maintenance insomnia. An onset insomnia will be where you go to the bed but you're not able to sleep. नींद आती नहीं,
नींद ही नहीं आती,
right? हम बेड पे लेटे हैं, थोड़ी देर के लिए लेटे, फिर हमने फोन उठा लिया कि अच्छा नींद नहीं आ रही, थोड़ी देर फोन देख लेते हैं, फिर हम फोन नीचे रख लेते हैं, फिर 3-4 बार करवटें बदलते हैं, जिसके चक्कर में हमारी नींद नहीं आ रही थी, पास में जो सो रहा उसकी नींद अलग खुल जाती है.
और गुस्सा आता है, there's this time, because there have been many days in my life that I've suffered with this onset insomnia, and it feels so irritating that everyone in the world is sleeping at this moment and I am awake, and it's such an aberration, as if it should not happen. Why am I so lonely at this moment?
So which is interesting that at times when we were talking about that cause and effect, that's exactly what I was talking about. When people say that I start feeling lonely in the night because I see that everyone is sleeping and I can't even sleep and I'm all alone. So that lack of sleep could actually become like an underlying cause for people to experience a sense of loneliness. And it can be the other way around also. Many times people are not able to sleep because they feel lonely.
Right, right.
Right? So that's about onset insomnia. Then there's the maintenance insomnia, where I go to sleep. I'm able to sleep quickly, but I'm not able to maintain that sleep. वो 2 घंटे में 3 घंटे में नींद खुल जाती है.
Hmm.
फिर I try to sleep again. थोड़ा time लगता है, go off to sleep, but फिर अगले 2 1 घंटे में नींद खुल जाती है. So I'm just not able to maintain that sleep, and that can also be very irritating because it's almost like अच्छा अभी तो नींद लगी थी यार.
Right.
Right? So that's another category of insomnia. So these are the two broad ways in which we divide the types of insomnia. One will be in terms of acute and chronic, and second will be in terms of onset and maintenance. Right? Then there are other things that can happen as a result of insomnia. There could also be physiological issues, right? Where people find it difficult to breathe, and because they find it difficult to breathe while they're sleeping, they end up waking up because they feel choked and so on, right? There's also at times the reverse phenomena where people get up but they are not able to move their body, which is known as sleep paralysis, right? So these are all different conditions related to sleep issues. But yeah, when it comes to insomnia, those are the 4 broad categories that we look at.
Okay. What about early wakefulness? People who wake up early and they are not able to sleep again. They want to sleep, but they're not able to sleep. But at the same time, they don't want to leave the bed and then start their day. I mean, many times it's recommended to them, hey, you woke up early. That's the most amazing thing. Why don't you just start your day? But they don't want to start their day because their body is asking for more sleep.
So what happens is, there are 2 components to sleep, right? There's your mind's ability to help you sleep, and there's your body's need for sleep. Now, when we sleep, many times it so happens that, when we spoke about the maintenance sleep, that you slept, but you woke up. Now, because you've woken up after 2 hours, 3 hours, the body's need for sleep is not over. So your body is still asking for the sleep, and therefore you're feeling very lethargic, very lazy. You just don't even want to move out of the bed, but you're just not able to fall off to sleep. Right? And there, if you ask someone to do something while they're not able to sleep, that doesn't mean that they've woken up feeling fresh. The lethargy, the heaviness is so high that also stops them from doing anything. And that's a big challenge that a lot of these people face. But this will predominantly be it will be for people who have onset insomnia. They will take it longer to sleep. So while they wake up in the morning at the time that they want to wake up, but their sleep is not complete because they could not sleep for hours, and therefore now they are not able to get up. And in case of maintenance, they may have slept at the time when they wanted to sleep. They just woke up early and they couldn't then. So the sleep is still incomplete.
Right. So for people who are struck with these kind of sleep disorders or sleep related problems, when they go and discuss this with their doctor, what they are advised is that, why don't you just take this little pill? It'll sort it out and you should get started. And then there are lots of worries that they have about getting addicted to the pill. They want to automatically sleep. They want to restore their bodies and minds capacity to fall asleep automatically, and they don't want to be on the pill. So is pill the only way to tackle with this problem? Because they have to get up in the morning and show the energy the world wants from them.
See, so let me break it this way. You can also look at insomnia's causes in terms of physiological causes and psychological causes, right? Now, where does sleep medication come in? Sleeping pills come in. Sleeping pills are like a makeshift arrangement. You're not able to sleep either because of psychological or physiological factors. It may take time for your psychological factors or physiological factors to be sorted out. But you still need to do what you need to do, like you mentioned right now, right? You still have to go to your office in the morning. You still need to be energetic all throughout the day.
Correct.
You can't be irritable throughout the day only because you did not sleep, because you still have a boss and you still have colleagues that you will have to interact with, right? So now, when you are in that situation where Immediate sleep is necessary because inability to sleep is interfering with what you need to do as a part of day-to-day life. And that's causing additional stress and anxiety because of which you're again not able to sleep. Then when you go to a doctor and a doctor recommends a medication to you, it makes sense because it's more like someone needs to do something about it right now. But is that the solution? In general cases, no. That's simply like a short-term, someone has given you a short-term painkiller to help you manage your pain, but the underlying reasons have still not been addressed. That's the reason why people then have worry about getting addicted to sleep. Addicted to sleeping pills.
That's, yeah.
Correct. Yeah. Why? Because they have not addressed the underlying cause. So now, if the cause remains, the sleeplessness remains. If the sleeplessness remains, then they need to take the sleeping pill. And that happens on an ongoing basis. What we generally recommend to people is this, that while your doctor may have recommended a sleeping pill to you, right? And if a doctor has recommended, I'm sure they've studied for all these years, so they know what they're doing. So let's trust them on the medication that they are giving you. But parallelly, start exploring what are the underlying reasons that are causing sleep issues. If your doctors are telling you that you have other physiological conditions that are stopping you from sleeping, for example, when you sleep, right? Your breathing becomes so shallow that you start feeling choked. Then you need to do something about it. If you are in a situation where when you sleep, your nasals get blocked, and because of that blockage, you are not able to wake up. Then you need to do something about it. If you have a lot of aches and pains in your body, and it's because of those aches and pains you're not able to sleep, right? Then also take care of those aches and pains. Having said that, this most people already take care of because this is very concrete. This is a pain that I know. The problem really happens when sleep issues are caused by psychological factors. Because you can't quantify them. People don't even know we need to seek help for it. And if we need to seek help from him, who do we seek help from? That's where you need to start exploring consulting a psychologist, a therapist more extensively. Because what happens is, let's say you have a lot of stress because of your work pressure. Now, when you go off to sleep, your mind is worried about all of those things. You're not able to sleep, right? Now, unless you address that stress, that sleep will still remain an issue, right? Similarly, there are certain people who will say that I have major anxiety when I try to sleep alone. So if you have that anxiety, it's important that you also go and get that anxiety addressed. Because if you don't, one, obviously you're not able to sleep, but that lack of sleep would lead to additional problems which will lead to more anxiety. So it literally becomes like a loop.
A vicious cycle.
It's a vicious cycle, right? So that's what we need to account for. Now that's where visiting a psychologist, visiting a therapist comes into play, and there are some really remarkable things that can be done when it comes to sleep, right? When we talk about therapies and so on. Plus, these are still issues that we're talking about, which are like bigger, broader issues. There are things that happen in our day-to-day life which we just don't realize have simpler solutions available to, right? So for example, when we work with people with sleep issues, one of the common issues we find is that my partner is working in the same room, इसलिए मुझे नींद नहीं आती क्योंकि लाइट खुली रहती है, right? You have eye bands available, right?
Correct.
But who is going through that challenge? उनको नहीं याद आता उस टाइम पे, उनको लगता है कि why can't my partner understand that I want the lights to be off?
Right.
So this is one which is very simplistic ways that you can do. I've had people telling me मेरे घर के बाहर construction चलता है, तो construction की वजह से आवाज नहीं आती, नींद नहीं आती है क्योंकि आवाज बहुत आ रही होती है. We have earbuds available, right? A lot of us that we can use to cancel noise. Now, if you can't stop that, you can always take care of this.
Right.
Right? Then comes lifestyle issues. There are so many people who will tell you, हम बेड पे सब करते हैं, खाना भी हम बेड पे खाते हैं, सोते भी हम बेड पे हैं, टीवी भी हम बेड पे देखते हैं. How does your mind know that you want to sleep?
Right.
You're going to do everything on the bed.
Right.
Right? Now, if you can consistently and regularly do only one thing on your bed, which is to sleep, your mind will automatically create a condition where every time you go to the bed, you sleep. Think of it as how many of us have a situation where we see someone's face and we get angry.
Yeah.
Now, why are we getting angry when we see their face? Because every time we see their face, we have associated them with certain things that they've done in our life, and we constantly think about it. That's
Right.
the only thing we think about when we think of that person.
Right.
So now the mind has created an association. You think about it and the mind is angry.
Correct. Correct.
The
Correct.
same can happen with sleep. That
Yes.
if you use that bed only for sleeping,
Right.
right? And if you're living in a city like Bombay, where for whatever reason you don't have a bigger place and there is only a small space, right? Keep different pillows. One pillow that you will use for everything else, and one pillow that you will use when you go off to sleep. That gives your mind a very clear indicator that when I'm using this pillow, it's time for me to sleep. That's how your system can prepare you to sleep better, right? Plus, the most interesting thing about sleep is people who struggle with sleeping are the ones who try very hard to sleep. And the ones who are able to sleep effortlessly are the ones who will tell you कि मतलब क्या आप बिस्तर पे जाते आंख बंद करते नींद हो जाती है.
Yeah, the message that we give ourselves, the label that we take, that I have a sleep problem, I have a sleep problem, I'm an insomniac, and as if it's like a big title, I'm an insomniac. Okay, so that's it's a big title that I must protect. So yeah, that happens. And in fact, the thing that you're saying about having different pillow, I think long back we had mothers and grandmothers who would have this practice that always use a new bed sheet for sleeping, and take off that bed sheet in the morning, fold it and keep it aside, and then again in the night spread a new bed sheet, clean your bed, so that just probably that also gives us the message that now the bed is ready to welcome you to sleep.
We also do it the other way around, right? Bachpan mein, we would be told that if you want to wake up, tell your pillow and your pillow will wake you up.
Right.
So again, those are messages that you're giving to yourself. Pillow and the bed sheet just becomes a way for us to associate those messages appropriately. Plus, with sleep, see, the thing is, sleep is a passive issue. It's a passive state. When you are trying very hard to sleep, you are actually telling yourself, I am actively trying to become passive. There's a contradiction over there. That's the reason the easiest way to sleep is actually to not make an effort to sleep. Now, obviously, that brings us to the question, how do I not make an effort to sleep? Right? The thing that we recommend to a lot of people that works for at least people who are looking at a quick way of being able to start sleeping without having to depend on pills. And then they can parallelly work with therapists and whoever they have to work with to address the underlying causes. Is when they go off to bed, you could do one of two things. The moment you're on the bed, close your eyes. When you inhale, count 1. And when you exhale, count 2. That's about it. Inhale 1, exhale 2. Because what happens is, when you're on the bed, your mind has a tendency to keep jumping from one thing to other. And that keeps the mind active. Now, you want the mind to become passive, but you still need it to be focused, right? And that's where the breath comes, that you are breathing, you're observing your breath, 1, 2, 1, 2, and in few minutes, you generally fall off to sleep. There are places where you may feel that I lost track of the count. So whenever you remember that, go back to 1, 2, 1, 2. This is very similar to people earlier saying count sheep when you're sleeping, right? The problem with that is a lot of people would come and tell me, Pata, we reached till 60, then we forget the count. Then later on, when we realize, bada irritation hota hai ki fir 100 se shuru karna padega. So that irritation stops us from sleeping. So here there's no problem with what count you are on. Every time you breathe in 1, every time you breathe out 2, right? And the alternate would be where you close your eyes and imagine yourself in a garden or a place where you feel completely safe. And just explore that place. You'll be surprised how quickly you fall off to sleep, and the quality of sleep is amazing because that safe space carries a positive feel with it, which takes you into a sleep state where you're already feeling safe.
In fact, I've heard the scripts of sleep hypnotists that are available on YouTube, and it's all about this visual safe place, about this serene calm place, going on a visual journey, one thing after another after another.
So it's a different way of doing 1, 2, 1, 2, because like I said, you need your mind to be not jumping from one place to another, and at the same time you want the mind to be passive. So when you're listening to these recordings, because you're listening to their voice, you don't have to be actively involved in the process.
Correct.
And the voice is guiding you through a imagination or a visualization, which helps you keep your focus within that safe space, and then that helps you sleep better.
Right. So, uh, you know, many people are confused about this, and it's a common question. How much should I sleep? What amount of sleep do I need?
See, at some point of time, it was believed that 8 hours of sleep is really necessary, right? But that's not necessarily true today. When I say this, because there are a lot of other factors that are into play. For example, like I said, there are two things to keep in mind when you're sleeping. There's the body's need for sleep and there's the mind's need for sleep. Mind needs to process everything that's happened in your life, and therefore it needs an X number of hours to be able to process that. And your body, depending upon how much physical exertion you've put in, it will require some amount of time to recover. Correct. Now, if you are someone who does a lot of meditation, visualization, guided imagination, relaxation, hypnosis, mindfulness, any of these processes, right, which allow your mind to get into a relaxed state even when you're not sleeping, your need for sleep will actually come down to a large extent, because then the primary purpose of sleep is for the body to recover, which generally the body recovers. For the kind of work that we do, we don't really have to go out and do a lot of physical activities, right? We are generally working in the safe confines of our rooms and ACs and so on. Now, if you are not really going out too much, then your body's need for recovery is relatively small. And that's the reason why there are people who will tell you that people who have been using relaxation for years, meditation for years, would tell you that we sleep for 4 hours, 5 hours every day, and we are able to do it's a really nice, peaceful sleep, and we wake up in the morning feeling very fresh.
Right. In fact, there have been many people who've told me regular meditators often say that their need for sleep is very less.
Because physically we are not so exhausted, and mental exhaustion is already being taken care of when you are doing relaxation, meditation, and all of those activities. So your need for sleep will come down, right? But on an average, for most people, it is still believed that 6 hours to 7 hours of sleep is important. It's very important, unless again you are involved in other activities that help you compensate for that sleep through other relaxation processes.
One of the questions that I ask people is that if you had a holiday for a couple of days, what time would you automatically sleep and what time would you automatically wake up? That would somewhere give you the average amount of time that you need to sleep, and probably begin with accepting yourself that this is who I am and this is what I need. Okay. Because there are people who need less sleep. Just be accepting of that, and there are people who need probably 8.5 hours of sleep, and that's okay. Acceptance is pretty important. What's your take on it?
It is, but Mayurika, the thing about sleep is some people just love sleeping.
Right.
So if you tell them, if you work, for example, to me, I, because of the way I work and the kind of work that I do, generally 5.5, 6 hours of sleep for me is really nice. Okay, I would wake up feeling very fresh and so on. But if you tell me, Nitin, you have to go on a vacation and you have time, you can do whatever you wish to do. I can sleep for 12, 13, 14 hours also. But that's simply because for me, it's simply a way of lazing around, right? And I can really sleep for that long. But do I really need that much sleep? Probably no. And I know probably no, because it's not that when I'm sleeping for 6 hours or 5.5 hours, that I don't feel sleepy, or that I feel sleepy during the day, or I'm feeling exhausted, or I'm feeling anxious about anything. It's just that that's the requirement that I have for me. But that's what you're saying is also true, that if you're not sure how much your sleep is, at least that could be a good starting point. That go on a vacation, see how long, maybe give yourself 3-4 days where you can sleep for as much time as you want to sleep. But after 4th day, start mapping at what time do you sleep and at what time do you wake up. That will give you a rough enough estimation of what is the amount of sleep that you require.
Right.
But when you go for that vacation, don't do too many physically exhaustive thing, because
Right,
automatically
right,
the
right.
need for sleep will increase. Then.
Yes, that's an important thing. That's very right. Too many physically exhausting things will definitely increase the need for sleep, the need for food, and that will color our perception of, how things are what is the right way, what is the right method for us. Are there any
So
warning signs of sleep deprivation? Yeah, you were saying something, please.
sure. So what I was saying is, so just to summarize this, start with keeping 7 hours as a base,
Hmm.
and then do some plus, some minus, depending upon how much. If you realize that I've kept 7 hours and every day I wake up in 6 hours and I'm still very fresh and very comfortable, right? Then maybe the requirement is 6 hours. If you have kept 7 hours and you still feel like, no, when the alarm rings, I need that half an hour after that, maybe start expanding that half an hour and see if that works for you. But that's the range that you need to play with, and that's a fair enough range to keep in.
My next question is, and we have very few questions now, is that are there any warning signs of sleep deprivation that we should be very concerned about?
See, the primary warning sign would be that you're making an attempt to sleep and continuously for a few days you're not able to sleep. So if more than 3 days continuously you're struggling with being able to sleep, that probably is the biggest warning sign, right? Apart from that, there would be other things, because once you're not able to sleep, it will affect your eating habits. You will either eat a lot, or you will stop eating, or you will start reducing the intake to a large extent. So that if your diet is getting influenced very extensively, then that would be the second indicator that I would keep in mind. If you're having a lot of mood swings during the day, if there are small things that are causing irritation in you, then that would be the third thing to keep in mind, right? But like I said, sleep is something so concrete that when you're not able to sleep, you're not able to sleep. You just know I'm not able to sleep, right? So that by itself is a very big indicator. If that happens for more than 3 or 4 days continuously, then that is in itself the biggest indicator.
Very quickly, before we go, if you could give us some thumb rules, sleep hygiene techniques, or sleep hygiene rules that we are supposed to follow.
Okay, so I'll tell you the rules that I follow, and then obviously you can see which of these rules work for each of you. But one, many of us have alarm for waking up, right? I would suggest keep an alarm for sleeping as well, because many a time now with Netflix and Prime and all of this, when you're sitting and watching, you don't realize when the time has gone by. And if you don't realize when the time has gone by, how do you sleep on time?
I have an alarm for sleeping,
Correct.
surprisingly.
So that's one, that put an alarm for sleeping, put an alarm for waking up. The waking up alarm should not be a jarring alarm. So a lot of us take the worst sound and put it as an alarm in the morning, that this will at least wake us up, right? But that's not a good idea, because what happens is the moment that jarring sound comes, for our mind, it was in a very restful state, and all of a sudden, some kind of a shock it has received. It goes into what we call as fight flight, right? And the moment you're in fight flight, you automatically get up as if there's a big crisis that you need to resolve. And that would then influence your entire day. So when you wake up, it's a good idea to have you have these snooze waking alarm, which will start at a softer voice and then the volume will increase.
True.
Those are good alarms to keep in mind, simply because what it does is it prepares your mind to wake up, and it doesn't come across as a very jarring sound, right? So
And
that's
the
it.
idea of waking up is also becoming so uncomfortable. We're teaching ourselves that waking up is a bad situation to be in. It will be a shock situation. So the mind will probably be scared of that as well.
True. So that's one thing that I would surely recommend. So alarm for sleeping, alarm for waking up, ensure that the alarms are not too jarring, and if you can have um the alarm which is increasing in volume, that will be a good idea. The fourth thing that I would recommend is, again, like we said earlier, have a specific indicator for sleeping. It will either be the bed, the side of the bed that you are sitting on, the pillow that you have, the sheets that you are sleeping on, but have something which will give you that consistency, right? So that's why people at times would recommend that it's a good idea to have a night routine before you go off to sleep. Because when you get into that night routine, your mind is literally preparing itself कि अच्छा अब सोने का time आ गया है. So that's another thing to keep in mind. I understand there are places where you have a lot of work and you may not be able to sleep when the time comes, right? But if it's happening for more than 2 or 3 days, where you're sleepy, but you're not sleeping because you feel there is a lot of work, just remind yourself what you will earn by working. You may end up paying a lot more to doctors by not sleeping on time.
Wow, the last one was so profound. So profound. Thank you so much, sir. I mean, this has been one of the best conversations I've had in recent times. And let me tell you, I speak to a lot of intelligent people. So thank you so much. I learned so much about it, about sleeping, although I've myself created videos on sleep techniques and sleep hygiene, and yet there was such a lot of information shared today. I understand that your work is in Mumbai, but can people outside Mumbai also reach you?
So everything that we're doing right now has been transitioned online. So irrespective of which part of the world you are in, you can connect with us. Both whether it's for training programs or for private consultation or any other conversation that you want to have. We are more than happy to have a conversation.
So you are Nitin Shah, sir, of ICHARS.
Yes.
iChars. Okay. Nitin sir from ICHARS. That is all that you need to type on Google, and you will find the best hypnotist, the best cognitive hypnotic coach in our circle in the country. Thank you so much
Thank
for your
you.
valuable time. I'm
Thank,
really indebted. Thank you.
thank you. Thank you for having me over here. And I hope everyone who has been through this conversation, they found something useful. And if you have any follow-up questions, please help them connect with us, and I'll be more than happy to take that up.
Thank you very much.
Thank you.